Hello, dear colleagues. Almaty City, Kazakhstan. My name is Mynzhylky Berdikhojayev and my assistant Abzal Khairatlo with Enzo from Mongolia. And we have two colleagues from Philippines and India, Rose and Gitin. So, Trotter, Abzal. Now we are planning to place guiding in external carotid artery. Patient has a small meningioma parasagittal on the right side, but usually that region is supplying from both sides, and if there is a problem on the one side, then it's possible to go from contralateral and finish the case. It's possible. And today it's a case number 2, and if you notice, patient has no intubation tube and the procedure is under local anesthesia. Қорқпай жата беріңіз, мен Mynzhylky Савошпын. Жақсы ма? Қорқпай жата беріңіз қазір. Тамырларыңызды тексереміз, ішін қараймыз. Okay. We need a rod knot. Yes. It was looked like there is no supply from the ICA, but it should be the vascularization from the one technical point: when you cause some spasm in extracranial artery, then it starts supply from contralateral side, and sometimes it's problem to see the meningioma. It's a technical point. And after that, it's possible to go with the microcatheter and check the meningeal artery. We have information from MRA with contrast, and it's very helpful. Okay, let's do this one magnified. Okay. Қозғалмай жатыңыз. This patient is moving. As I said, the flow is coming from contralateral side. Stop, назад. When you cause some spasm, then it's a problem. Yes, meningeal artery is in place. Okay. We can take headway duo. Headway duo бери салшы ташполотына. И траксес. 156. И астында траксес бар. Шевелится. Так, ДМ жинап қоя сал. Yes, it's a good combination of headway duo, like a 17 microcatheter, but it's very navigable catheter, and it's possible to send distally. In a meningioma case and in approaching meningeal arteries, we are using headway duo. And a nice combination with Traxxas, because the meningeal artery is a killer of hybrid and Mirage guide wire. If you try to use hybrid and Mirage in the meningeal artery, they will die. They will damage very quickly. That's why Traxxas is long existing in meningeal territory. It's very important. No need. I think no need. We'll place and headway duo. We started using headway duo in 2019. It was a Columbus microwire from Rapid Medical. It's deflectable microwire 14, and you can bend the tip of the microcatheter inside the aneurysm. And recommended microcatheter was headway duo, and we start to use headway duo, and then we realized it's a very good microcatheter. And we started to use with Traxxas and Chikai Black, and then Rapid Medical stopped producing Columbus, but now they're working on another 25, I think, microwire. Mostly in the United States, our colleagues using big microcatheters for penumbra coils, for aspiration. That's why I think it's a 25. The guiding catheter is 7 French. We placed short sheath 7 French, and then Judkins Wright guiding catheter. Okay. Okay, this is a territory of maxillary artery, and somewhere here it should be. This is meningeal. There is some tortuosity here. Okay. It goes here. Okay. Now it's territory. Okay, let's do angiography. Per second. Bir is 1 second, bir second. It's like in Turkish language, bir in Turkish will be 1. Same, counting. Yes, now we can see the meningioma, yes? You see? From the yes, there is a tiny supplier from the frontal part and a bigger supplier from the back part. No, the tiny supply from the back and bigger supply from front. Lidocaine genesis? No. Asked for lidocaine. We will use Adnan technique. Adnan technique is 4 cc of lidocaine, 1-2% of lidocaine inside the artery, and then it's possible to navigate with less pain and less problem. Okay. This not really visible. It looks a little bit tortuous, but let's see how the wire will go. There's also time there. It looks it will go. It's a small branch. It's also possible to inject from here, no problem. But I will try to go forward. Okay, it's stopped here. It's a wedge position. Tartar. Yes, we need to turn in the frontal direction. Yes, and it's parasagittal. Кондиционер 16 қойсаңшы что ж плотно. Okay, I especially kept this needle. It comes with Traxxas. It's a shaping needle, and I will do small curve. When it's smaller curve, like this. Yes, it's also possible to inject from here, and if it's needed we can bring one more microcatheter and place a couple of coils. It's option number 2. Алдындағы ангиографияны қойсаңшы, смарт маск. Жаңағы ангиографияны смарт маск. I'm asking to place this angiography as a smart mask. Yeah. Thank you. Thank you. Now it's two-shaped, yes. Yes, and all the time we need to keep in mind it's a very tiny vessel, and it's possible to rupture it. Okay, now it's better. Аға бәрі дұрыс па? Ауырып жатыр қазір. 1 секунд. Okay. 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 Yes. Ангиографию қойсаш будет? Стоп, назад. Нажал курсор, чтобы ориентироваться. Штаб-зал to place it as a referent to have some orientation. Okay. Лидокаин дайын ба? Kazra. Yes, it's a wedge position, and we can inject from here. Observe. Yes, it's quite good combination of two devices from different companies. Squid. Squid жинайбер, ДМСО бар ғой? Okay, now let's see it like this. And usually it may communicate with the. Usually it's communicate with the superficial temporal artery. There is a connection, and we should to look for the skin. And it might communicate with ophthalmic artery. That's why we need control the frontal part also. Lidocaine бар ма? Okay, we have lidocaine on the table. Now let's do. It's not mostly the meningioma. Maybe we're too distal.
I think too distal.
Yes, now it's like a dural fistula. Directly injecting inside the sinus. Okay, let's bring it a little bit. Not so much. Where is the meningioma? Where is the meningioma? Ah, I see. There is a small branch proximal, just before this curve. Okay, smart mask. Smart mask. Yes, just a second. Okay. Қозғалмаңыз. It's a little bit proximal to this point. A little bit. 1 millimeter is proximal. Okay, here I think. It should be here. Yes, now it's going to the meningioma also. A small, tiny branch. Okay. This is lidocaine 4 cc, and we're injecting to the meningeal. It's like in dentistry. Dexamethasone 12. Ксифакам. Демсо. Отлично. Анан екі крестик болсыншы. Okay, we increased the radiation rate. Берер. Squid берер. Okay, let's wait for some analgetics. Әрбір айналдырып көрші. Yes, and patient a little bit moving, and now we can see the meningioma also, not only the artery-venous connection. This is the explanation why the dural fistula is so easy forming after thrombosis. The artery is, there is no dural fistula, but when we very close to the sinus, you inject from the meningeal, you can see the sinus at the same time. Yes. But it was no fistula, yes? Okay. And at the time of thrombosis, it starts to be more hard and more functional. That's why we start to see these structures. Okay, let's see. This is artery.
Қозғалмаңыз. Қозғалмаңыз.
Сәл шыдай тұрмыз. Алып тастайсың. Yes, it's inside the sagittal sinus. Аға, қимылдамаңызшы. Қазір қояды ауырған. Иә. Наркоз берсе, бұдан да қиын болып кетеді, да?
Қозғалмаңыз.
Okay. It's like a chronic subdural, yeah? Қазір қимылдамаңыз, аға. Қояды қазір. Сәл шыдай тұрыңыз. Yes, it's coming from collaterals. Болды, қояды қазір. There is no flow. It was this tiny branch. This branch is going to the... this branch is going to the meningioma. This goes to the parasagittal. This goes also to the parasagittal. Okay, let's check. This branch is going to the meningioma. This is not going to the meningioma. This also not goes to the meningioma. And now we can say the same. You see, there is no meningioma. Is it?
Қозғалмаңыз.
It's not going to the meningioma, but it goes everywhere. Okay, we'll occlude some additional territory. Okay. Bold. It's not penetrating the meningioma because the branch was too small. Okay. I think it's enough. We occluded all this territory. You can inject a little bit more, or it's enough?
I think enough.
Okay. Let's take the catheter. Қазір. Surprisingly, when we will do CT, you can see there is a liquid embolic inside the meningioma. It's very surprising. I a little bit pulled the widening catheter. Can't раскрыть. Can't раскрыть.
Контраст.
Болды аға, болды, қазір бітіреміз. Сәл қалды. As the meningioma is not visible from the ICA. And now let's go to the left external carotid territory. Жеңіл өтіп пе еді?
Ау?
Жеңіл өтіп пе еді маған?
Жеңіл емес.
Жеңіл өтіп пе едің деп.
Жеңіл пе.
Окей.
Ақырын өзі секіріп түсті. Почтадан ақырын тартқан кезде түсіріп бақ.
Окей. Не болды аға? Қазір бітіреміз. Сәл қалды.
Қозғалмаңыз. Қозғалмаңыз.
Болды. Айналдыра. Кіріп кетеді қазір. Наоборот. Басқа жағын. Все, кірді ғой. Кір. Okay, let's... Cheers. Прямой трубканы тура қоясыз. Не болды аға? Оу!
Бәрі жақсы ма? Ал.
Дұрыс, бітейін деп жатырмыз.
Сіз қозғалмаңыз, сіз Mynzhylky істетсіз ғой бізге. Қозғалмаңыз, не двигайтесь?
Қозғалмаңыз, сөйлемеңіз. Ұрады ма? Қозғалмаңыз, сөйлемеңіз. Жоқ. Navigate. Okay, just a second.
Остаток даемся?
예. Қозғалмаңыз.
Okay, bold. Now I will ask Abzal to compress the right IC. Он жақ сонымен бастасашы.
Қозғалмаңыз. Қозғалмаңыз, жақсы ма?
Because of the spasm in this territory, we couldn't see the control artery. Бас. Stop тұр. Compress and wait. Бастың ғой? Stop тұрсың ғой? Все хорошо. Қимылың.
Қозғалмаңыз.
Жібере сал. Okay. It looks everything's okay. And now we will do control CT. Abzal. КТ. Control CT. Okay, dear colleagues, the brain looks normal, and let's try to find Meningioma is here. Okay, axial, and this is Meningioma. Okay, let's see. We occluded the supplying territory, and on Monday we will do control MR with contrast, and we can see how much of the meningioma is ischemic. Option number 2, we can go to the left side with microcatheter and we can check it, but I think it's enough for today. We occluded the main supplier, and because of small spasm in proximal part, it's not going, and it's a problem. That's why maybe from some reason it's better to take something soft like Fubuki or chaperone guiding catheters, and they can show how much is supplied. Yes. But this territory looks like there is a supplier. Okay, I think we need to go to this branch and check it. There is some tortuosity here. Abzal, guide pen kriviš naruška. Okay, we will check. I think it's very important to check, and this territory. It was look like the artery is coming from right, and there is a U-turn and going from left to right. And now it's look like from left to right. Yes, and here Abzal did the cutting the view. I think it's better to go and Жень, меня пока выключите звук. Yes. The sensibility for the pain is also one more factor. Just a bit. Yes, I think I need a little bit sugar and стоп, назад, 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 назад. Все. Смарт насколько. Хорошо. Okay, let's continue. Okay, we decided to check the contralateral side before finishing, and I think it's important. There is some spasm. Okay, it went from the spasmatic point. No. Now there is a meningeal artery coming from this point. Okay, this is meningeal. Let's went to the ophthalmic collaterals.
Оң жақ наружканы көрсетесіз бе? Рахмет. Оң жақ наружканы көрсетесіз. Оң жақ наружканы көрсетесіз.
Не болды деп сұр.
Ауырып жатыр ма не болды? Иә. Ашық айтыңыз енді. Қазір не салды, обезболивающий салды, қазір бастады.
Наркоз шақыра салыңдаршы.
Асылы?
Вообще наркоз бере салған дұрыс болар шығар. Yes, we are at the point. That's why it's painful. Yes, it's crossing the midline. I think we need to switch for general anesthesia. Okay, наркоз берсінші. Наркоз бере берсін. Поверсін.
Наркоз.
Хорошо, сейчас попробуем. Если вы будете такие же звуки издавать, тогда мы дадим наркоз. I'm so sorry for my French language. It was something like merda, yeah? Merda. Не бересиш? Yes, maybe we'll take Chikai X. Chikai 8, not X. Maybe. Yes.
No, what?
I think it will not go because there is a tortuosity. Okay, it went. I couldn't take my traxes out. Okay, now it's better. Or is it's not this branch. I think should go to this branch. Таш по таа бір траксес аштай жасаңызшы. No traxes wood. This traxes is kaput.
Процесс дошел.
I think everybody can understand kaput. Тройс бак. It supplies the meningeal territory, but I'm not sure it supplies the meningeal artery. Huh? And everything looks like okay. Var mı? Verirsin. Okay. Now the fentanyl is on board. There is some connection between right and left, but I'm not sure there is a connection to the tumor. But we are here, and it's better to inject liquid embolic to be sure that everything is disconnected. Huh? Okay. Okay. Which branch is which? Huh? I think there is a little bit branch before. Smart mask, huh? Yes, it looks like there is a branch one before. Yes, here's a branch, and it's supplying the same territory.
Yes.
It looks like it's supplying the territory of Meningioma. Okay. Let's check. What's there? Yes, it's supplying the meningioma. Тағы да 2 кубик ледок айналысыш. lidocaine and fentanyl, yes, DMSO. DMSO. Yeah, lidocaine. We will give 2 cc more lidocaine. Қорықпай жата тұрыңыз, қазір бітіреміз уже. Enzo. Okay, let's see where we are. The branch from right was look like this and coming back, yes? And now we are antegradely. I hope we are antegradely. Okay. We'll inject 2 cc of lidocaine, not 4. Yes, and then we finished all headway duos. And just after lidocaine I gave DMSO, and now I will ask Abzal to give me squid 12, huh? The second syringe of squid 12. Yeah, no, it's okay. Let's check like this and like this. Glue. It's glue, huh? Okay. Терең демалыңыз, шыдай тұрыңыз. Терең демалыңыз. Енді бетке демала беріңіз. Сәл-сәл ауырады, шыдаңыз, жарайды ма? Yes, now we're inside the meningioma. And also we little bit filled the territory of superficial temporal artery, and it's a sagittal sinus. Okay, I will inject a little bit more. A little bit more.
Қозғалмаңыз.
It's a prophylaxis of complications. It's a migraine treatment, yes? Okay. Болды аға, бітті. Енді точно бітті. Енді точно бітірдік. Қозғалмаңыз. Окей, все, қозғалмаңыз. Демалмаңыз. Let's do again the city. Okay. Let's check. Sorry. Қорықпай жата беріңіз, қазір қояды. Сәлден кейін ауырғаны қояды. Наркоз болса тамақта трубка тұрады, өте неприятно, да? Ойдағыдай, жабылды. Қорықпаңыз. Ем болсын. Okay, dear colleagues, this is second control CT. The brain is normal, but the goal is to check the meningioma. Now meningioma is filled by contrast and liquid embolic. Okay, it's very important. Now we see the meningioma, and let's play with the yes. Now we are sure that liquid embolic is inside the yes. And last week my friend Alberto did the expert CT. Yes, it's expert CT. Then it's a MIP. Yes, now we created the cast of liquid embolic inside the meningioma, and the possibility to have a total occlusion and the resorption of the meningioma now quite high. This example that soft tissue. Okay, let's see. Yes, we need to bring Alberto one more time. He is using Philips system very efficient. Yeah? He's doing like this, and now I can see. Yes, this is meningioma and thickness. Okay. Yes. Now I can sleep. I can sleep well. Okay, thank you, dear colleagues. Now we can finish this case. Both meningeal artery territories is occluded, and the meningioma now occluded with liquid embolic, and I hope patient will recover from meningioma and control MR in a couple of days. It was a little bit painful procedure, but now pain is releasing. Thank you for watching. See you in next 25 minutes. Okay, see you.